talk is a general practice careers talk, and that's going to be starting in about 15 minutes. Thanks, guys.
Thanks, bye.
Hi.
Hi there, I'm Kate.
Bridget.
GP career session.
Yeah. Just be starting in about 15 minutes, 10 minutes time, but just, yeah.
And do I just click the little TV screen at the bottom to share slides?
If you've got the slides, you can just...
Yeah, I'll just practice and make sure that works.
Yeah.
I think
Sorry?
My colleague Kai should be joining as well. She's speaking too.
Yeah, I've just approved her.
Okay, perfect.
Yeah, I was just going to say, if you're showing your screen, I think there's like an option to share your whole window, your desktop. Just make sure to press desktop, so you only... Sorry, to share the window of what you're sharing, just so that's the only thing that's sharing your whole computer. It's not sharing. No problem.
Hi everyone, it's 11:45. I'm Katrina, I'm moderating the hub here today with Bridget. I'd like to welcome everyone who's here to learn about different medical specialties, and also to our speakers, Dr. Katie Scott and Dr. Kai Wang, I hope I'm saying that right, who are here with us from Imperial College to talk about careers in general practice.
Thank you very much. So, as you said, we're going to speak about general practice careers today on behalf of the Primary Care Department at Imperial College London. So, introductions. So my name's Katie. I'm a GP trainee based in South London. I've currently taken a year out of my training to work at Imperial College as a teaching fellow, and I'll return to general practice training after I've completed this year. In terms of my background, I graduated from the University of Leeds in 2014, and I've worked in West Yorkshire, the North East, and London. And I'll hand over to Kai to introduce herself as well.
Hi everyone, I'm Kai. I'm also a GP trainee. I'm in my second year of GP training, currently based in the northwest of London. So this year I'm actually doing sort of part-time GP, part-time teaching fellow job. So yeah, I spend a few weeks with the academic department at the Imperial College Primary Care Department. So for my foundation years, I was based in Bristol, and I graduated in 2016 from Nottingham University.
Thanks, Kai. So just an overview of what we'll cover today. We'll have a brief introduction to what primary care is, and then we'll focus on general practice careers. So we'll look at the day in the life of a GP, different GP career options, the pros and cons of being a GP, think about our own careers that we've had so far and our aspirations for the future, and then look at the end at how you can apply for GP training if you're interested. We should have plenty of time at the end for a question and answer session. So just to start with, I've got this quote. So it's, if general practice fails, the whole NHS fails. And I think that's really true. So there's over 300 million patient consultations within primary care in the UK each year. And that's compared to only 23 million A&E visits. So primary care is really the gatekeeper to the secondary care services in hospitals.
Oh, Katie, I'm not sure that if we can see the screen. Just looking at the chat, it says no one can see the PowerPoint at the moment.
Okay, let me have a look. Thanks, Kai.
No worries.
Can you see it now?
Yeah, that's better.
Yeah, perfect. Sorry about that. Thank you. So in terms of primary care, so it's not just GPs within primary care, so there's lots of other healthcare professionals that work within primary care, including dentists, nurses, and lots more. There's lots of services that are traditionally in secondary care that are also being moved to community care at the moment as well. So primary care is set to become bigger in the future. So primary care is really essential for the prevention of disease and screening, for managing chronic diseases, for managing multiple diseases in a holistic way, for the triage of acute illnesses before referring patients to hospital. And what I really like about general practice is the longevity of care that you can have with patients and the ability to build relationships, which can be a little bit more difficult in a secondary care setting. So I'll hand over to Kai now.
So yeah, I'll take you through sort of a typical day in the life of a GP. Although I guess typical is probably the wrong word, because no day is ever exactly the same. And obviously since the beginning of the COVID pandemic, a lot of things have changed in general practice. So we're trying to sort of limit the number of face-to-face appointments at the moment. And everyone that is brought into general practice to be seen by a GP does go through a telephone triage to begin with. So I probably typically start my day as a GP trainee, getting into the office probably about 8:30, checking in to see what results have come back from the day before, maybe having a look at if there's any prescription requests that need to be done, checking if there's any outstanding tasks to be done. And then 9 o'clock is usually when my first patient appointments start. So in general practice, you typically get about 10 to 15 per patient, which is quite challenging, but it's definitely doable. Some patients are new to you, some patients could be follow-ups, and you're dealing with, it could be very acute problems, or it could be chronic so long-standing problems that have been going on for a while. And obviously in general practice, there's a huge range of patients that come in through the door of all different ages, from birth to people who are nearing the end of their life. So in a typical morning, it's really unpredictable to see just see what comes through the door. So it might be someone who presents with chest pain and is having a potential heart attack. Your next patient could be a 5-year-old child who has a sore throat and you're suspecting tonsillitis. Your next one could be just a chronic diabetes review, and the next one could be someone with back pain or mental health issues. I'm just thinking about the patients that I've seen in the last week or so, and it's just such a broad range of presentations and diagnoses. So for some of the patients, you can reassure in the appointment itself. Some of them will need follow up with you. Some of them you can treat on the spot if you have it's an obvious spot diagnosis. Some of them refer into hospital for maybe some specialty advice. And obviously there's some presentations which are, patients acutely unwell and they need to go to A&E, and then you have to send them into A&E when you recognise that they're acutely unwell. And there's also options in primary care, obviously, to refer to community teams as well. So you've got physios in the community, dietitians who are available to support you, district nurses who can help. So it's a very, very multidisciplinary team that you have access to in general practice. And then by about 1 o'clock, 2 o'clock, between that time, is lunchtime, but you've also probably got a bit of admin to do at the same time. So checking blood results again, any discharge summaries from hospital. So patients who have recently been in hospital, we usually get a discharge summary back. And if there's anything that needs to be actioned, any referrals that need to be done, I'll probably try and do them at lunchtime as well. In my practice, we also have practice meetings every so often at lunchtime where we sit in with other GPs in the practice, discuss any difficult cases. And if we have any questions, especially as a GP trainee, there's always someone to ask for help if you're not entirely sure what's going on with the patient. It's also a chance to just catch up with your colleagues as well and socialise a little bit. And then after that, about 2 o'clock, so after lunch, we may do some home visits. And these are for patients who are housebound and are not able to get into the surgery themselves. So there might be people at home, or there might be people who are living in care homes or nursing homes, and usually quite complex. So you usually spend quite some time there. So patients could be very unwell, or they could be nearing the end of their life, and you're sort of palliating and helping them with controlling symptoms of their pain. And then by afternoon surgery, you come back to the surgery after your home visits. And it's pretty much the same as the morning. So anything could come through, and you try and triage and treat or refer on. And then by evening, about 5:30, try and finish up all the admin that's you've got. So more admin. Any other catch-ups and referrals need to be done hopefully before you go home. So it's very variable. It's very different, but very rewarding and interesting. So if we go on to the next slide, hopefully we've got a video that is from the Royal College of General Practitioners, and it just takes you through sort of a typical day and some common presentations that we see. Hopefully it works.
I don't know if it's the case for anyone else, but the video doesn't seem to be, it seems to be quite laggy on my end.
I can't hear the sound, Katie.
Okay, what we'll do is we'll skip it, and what I can do is I'll put the link to the video on the chat at the end, and then you can watch it in your own time. Okay, it's just on YouTube. Right, so we'll move on. Sorry about that.
So just wanted to talk about what additional roles GPs can have. So if you'd be able to type on the chat what additional roles you think GPs can have other than just doing the normal clinics. So for example, just a media GP, for example, so Dr. Zoe Williams from This Morning, she's a media GP. Can anyone think of any other roles that GPs might have? So we've got some answers starting to trickle in through the chat. It's got nutritionist. You can definitely advise patients on nutrition if you have a specialist interest in that area. Quality improvement, yeah, everyone, especially as a trainee, we always get involved in quality improvement projects. Psychologist, GP with special interests, yeah, we'll go on and talk about that in a moment. Lecturers, sports medicine, education, yeah, going to local services and schools and talking there. Physio, mentoring. Great, there's some good answers there. If we go on to the next slide, we'll talk about a little bit more about that. So yeah, there's clinical options and non-clinical options. So it's such a broad specialty. So depending on where your interests lie, I think there's a lot of things that you can do after you qualify as a GP. Some you'll need sort of extra qualifications later on, and some. So in terms of the clinical options that you can have, so a lot of doctors choose to give up their time and work voluntarily, so doing charity work either abroad or in the UK. If you're interested in traveling, there's the option of being sort of expedition doctors. Or prison GPs, forensic medical examiners, you can work in the armed forces. And yeah, just going on to someone mentioned GP with specialist interests. So lots of GPs are starting to develop specialist interests. So common ones are, you know, diabetes or dermatology, gynecology, pediatrics, and sports medicine. It really depends on where your interests lie. And then there's the out of hours work as well is always available. In terms of the non-clinical options, people can sometimes get involved in medical legal side of things. So working with the General Medical Council and MGU MPS. You can work in medical education, such as me and Katie, that's what we're doing this year. Public health, options to get involved in research if that's what you're interested in, medical journalism if you're interested in writing, and media GP, which is what we mentioned before. So lots of GPs have what is called a portfolio career, so they might work a few days in general practice in a normal clinical setting, and then another couple of days either, you know, doing one of these options here. So yeah.
Thanks, Kai.
No worries.
So now we'll move on to thinking about the pros and cons of being a GP. So it'd be interesting to hear what you think about this. So it'd be great if you could put on the chat, first of all, what you think the pros of being a GP are. And Kai, are you able to read them out to me? Because I can't see the chat while I'm screen sharing. Thank you.
Sure, yeah. So there's no right or wrong answer, just put what you think. What are the pros and cons of being a GP? So, oh, great. Oh, I should have scrolled down on the chat. So flexible lifestyle, more structured working hours as a pro, being part of the community. It's very rewarding, the variety of things you see. And question mark, hours worked are less than a doctor. Flexibility, no night shifts, variety, more social hours, meeting a wide variety of patients with diverse illnesses and problems. Get to meet people from all walks of life. It's more patient-orientated work. You get to make long-term relationships with your patients. Wide discovery in lots of different illnesses. And last but not least, not just physical problems, but also mental and emotional problems are treated and evaluated.
Perfect. Yeah, thanks so much. You've covered a huge range of pros there, which I agree with those. And so particularly what I find really good about GP is, as people have mentioned, the holistic care you can provide. So not just thinking about perhaps the physical illness that the patient has, but also other contributing factors to that. So it might be in terms of their lifestyle, and also thinking about mental health at the same time. And within that holistic care, it's quite nice to be able to build long-lasting relationships. So that's something I really like in general practice. And also seeing families. So you might see a child one day and their parent the next time. And I think that's one of the things that really appealed to me in general practice. And as people have also mentioned, it is quite flexible. So we've spoken about other sort of interests that you might pursue in your career, and there's a lot of flexibility in GP to be able to do that. It's probably a little bit more easy to work part-time in general practice and part-time in something else. Not to say that's not possible in other careers, but it's quite easy to achieve that in general practice. And there's a huge variety, so you get to see all different ages of people, from newborn babies, and then seeing patients reaching the end of their life as well. And I really like that aspect and variety of different conditions that you see too. In terms, somebody mentioned in terms of the hours and being different to a hospital doctor. So I think certainly there's less weekend work and night shifts in general practice. You may have to do some weekend work, and you may choose to do night work in terms of out-of-hours services, but that's at the moment more of a choice than compulsory. And obviously in a hospital setting, you might be doing more out-of-hours work. In terms of the hours, I think general practice tends to have quite long days. So yes, you're not working at the weekend, but you may start a bit earlier and work a bit later than some hospital doctors, but it just really depends on different specialties. It'd be interesting now just to hear what you think the cons of general practice are as well. So if you just pop in the chat what you think.
So 10-minute appointment limit, quite a large workload, and there can be on-calls, lots of paperwork, time constraints, less hands-on work, lots of admin.
Perfect, thank you. Yeah, so I think that covers most of them. So for me, the trickiest thing, especially as a trainee, I'm still learning, is the 10-minute appointments. So I actually, in general practice, have 20-minute appointments, and I think that's just about right. So I'm sort of dreading going to 10-minute appointments. I think that can be really hard to do a good job in 10 minutes, but certainly as you get more experience, you get better at being able to do that, I think. And there is a lot of multitasking, so lots of things happening at the same time in general practice. So you might be seeing a patient, but there may be sort of an urgent call that comes into reception, and you might be asked to deal with that at the same time. And sometimes you're supervising medical students and trainees as well as running your own clinic. So there is certainly a lot of multitasking, which can be difficult. And there is a lot of paperwork. So as Kai mentioned, in the day in the life of a general practitioner, and we mentioned all the administration work that you have to do as well. In terms of somebody mentioning it being less hands-on, I probably disagree with that. So I think you do get a lot of patient contact in general practice. Obviously, it's a little bit less now because of COVID and the move to more virtual and telephone consultations. But I think actually you get to see more patients and be more hands-on than some of the hospital specialties, in my opinion. Okay. So we'll just speak a bit now about how you get to become a GP. And so you'll complete medical school, which is typically 5 to 6 years long, and then you'll do your foundation training in the UK. So that's where you spend 2 years working in different medical and surgical specialties to get a broad overview of both medicine and surgery and experience in both areas. So usually you do 6 jobs, each of 4 months duration during your foundation training. So I did my foundation training in West Yorkshire, and when I was there, I worked in paediatrics, in acute medicine, in general surgery, in ear, nose and throat surgery, A&E, and general practice. So a really good variety of things. And after foundation training, you can then apply to specialty training. So GP training is typically 3 to 4 years in duration. And if you choose another specialty, that tends to be a bit longer. So typically around 6 to 8 years long, and can be longer depending on what you do in addition to that as well. So in terms of myself, I actually decided to take some time out after foundation training before applying to become a GP trainee. So I took 2 years out, and for the first year I worked as a paediatric teaching fellow. So I'm quite interested in paediatrics, and I wasn't sure really if I wanted to be a GP or become a paediatrician. So I worked as a year as a teaching fellow in paediatrics, which involved half of my week I would spend working clinically on paediatric wards and A&E, and then half of my week I taught medical students. And I really, really enjoyed that role. For my second year, I worked as a locum doctor, so mainly working in paediatrics again. And when you're a locum doctor, you have a bit more flexibility of choosing when you work and where you work. So you're not on a sort of contract that says you need to work in this hospital for this long and all these shifts. So that was really nice with the flexibility of that. And that allowed me some time to go traveling. So I spent some time in Australia, New Zealand and Costa Rica during that year. As I've got an interest in medical education, during those 2 years, I also completed a postgraduate qualification in medical education as well. So I went back to university part-time during those years too. Then I decided to enter GP training. So as I said, GP training is typically 3 to 4 years long. So for most training programs, it's 3 years long, and you spend half of that time in hospital placements and half of it in general practice. This is changing. So I believe from 2022, people entering GP training will spend 2 years in general practice and 1 year in hospital. So 6 months less in hospital, but 6 months more in general practice in the future. In terms of what I've done within general practice training, so I've rotated around lots of jobs. So I've worked in renal medicine, elderly medicine, obstetrics and gynecology. I've done more paediatrics, and I've also worked in a hospice in palliative care, alongside obviously doing general practice placements as well. Some training courses might be 4 years long. So some examples of this, you can apply to be an academic GP trainee, and that's where you can combine general practice training with research or teaching. And there are some placements that are 4 years long in rural GP training. So most of these are in Scotland. And that's because if you're working in more rural areas, you may have less access to secondary care services. So you need additional skills to be able to work as a GP in those areas. So that extra year gives you a bit more time to train in the extra skills that you will need. As I mentioned before, this year I'm working at Imperial College London as a teaching fellow. So I've taken a year out of my training. So I've finished the first 2 years, and then I'm taking a year out before I return for the final year. So within this role, what I've done is I'll be teaching medical students across the primary care curriculum and also undertaking medical education research. And there is opportunity to do other things within GP training or in other specialties where you take time out to do things that are of interest to you. So that might be working abroad, doing research, there's lots of opportunities available. In terms of my career aspirations for the future, so I'd like to be a GP with a special interest in paediatrics. That's what I enjoy. So that might involve seeing additional paediatric patients in GP, or potentially working in a hospital setting in paediatrics. For example, I really like paediatric A&E, so that might be something I try and do. I'd like as well to work in medical education. So either that might be working for a university like I'm doing now, or perhaps training people to become GPs, alongside, of course, working in general practice. So that's, as Kai mentioned before, a portfolio career, and that's what I hope to have in the future.
So just for the last 5-10 minutes, I'll just quickly run through how you actually apply for GP training. So the application has slightly changed a little bit for this year and next because of the COVID pandemic. So there are no face-to-face interviews anymore. So initially, the step one is still the same. So you submit your application via Imperial, which is an online platform which all specialties use to apply for any specialty. You've got to obviously meet the eligibility criteria and have completed your FY2 Foundation Year 2 competencies. There's usually 2 application rounds per year. So at the time of application, you'll be asked to rank your preferences in terms of location and the GP programs. So unless you've got you've already got in mind exactly where you want to go, I'd probably recommend having a look through the different websites for the different individual regions, the GP programs and rotations that they have available. Just do a bit of research before. So things to look out for are, what type of programs they run, the geography of the location, transport links, house prices, things like that were sort of all taken into account when I chose my rotation. There's also something I need to mention called the Targeted Enhancement Recruitment Scheme. So it's a scheme which offers incentives for GP trainees who are committed to working in certain areas of Scotland, England and Wales. So it's actually a £20,000 one-off payment, and it's for places which have been historically quite hard to recruit for in the last 3 years, usually because of their geographical location. The training is exactly the same, it's of high quality, but it's just the less sort of popular places like, for example, like the Isle of Wight. So after you've submitted your application, there's something called the Multi-Specialty Recruitment Assessment. So that's a computer-based examination, and it consists of 2 parts which have equal weighting. So part 1 is a situational judgment test question. So if you've done if you're in your final year of medical school, everyone has to sit an SJT. So it's very similar. So it's questions that sort of it's non-clinical, but it's just judging how you'd act in different situations, and you have to rank your options there. And then part 2 is a clinical problem-solving question. So more sort of clinical knowledge is required, but only at a sort of Foundation 1, Foundation 2 level. And then, so this year, I think so usually before the pandemic, you would have gone through to the interview stage if you'd done well on the MSRA, the Multi-Specialty Recruitment Assessment. But this year, because of the pandemic, you are basically just ranked nationally based on your MSRA score and your area preferences. And then you'll get a job offer, hopefully, at the end.
Perfect, thanks, Kai. So we're going to do a question and answer now. So please feel free to ask us any questions about general practice training, or even foundation years, as we've both done that as well. I've just popped our emails on the screen. So if you did want to email us anything afterwards that we haven't been able to answer today, or you didn't have the opportunity to ask, then please do email us. I'll stop sharing my screen now so I can see the chat, but please start putting questions in.
If it makes it easier, I could just read the question and you guys could just answer it. Then you guys having to scroll through. Up to you.
That's perfect.
Sure.
So we just had someone wanting to clarify. This was from Rachel, wanting to clarify that if you wanted to do a specialty within GP, does that mean it takes longer than 3 years, or?
Yeah, I can take that question. So no, so you typically, your special interests in general practice, you sort of develop more once you're qualified. So it's not part of the GP training itself. You can, however, so I like pediatrics, and I spent a bit of more time working in pediatrics before entering general practice training. And I'm also at the moment doing a diploma in child health. So that means just doing a little bit extra revision about child health and taking some exams. So I'm doing that during general practice training, but it's not sort of an official thing. So once you've qualified, then you can either you could do extra qualifications once you've qualified as well. But it's just about you speaking where you work and maybe see if they're looking for somebody with a special interest in something, and you might take additional cases in that. Or like I said, there is the possibility of working in hospital settings. So GPs can work in A&E, or they might work in palliative care and hospices, for example. They might do secondary care clinics alongside consultants as well. So it's quite flexible, but there are additional qualifications you can do in different specialties if you're interested as well.
Kind of answers the next question, talking about, for you to just talk a little bit more about special interest. I don't know if there's anything more you want to say about that, but I feel like you've kind of covered it a little bit.
It's just some special interests you don't need to do extra sort of diplomas for. So my current GP trainer now, he has a specialist interest in diabetes. And I don't think there's a specific diploma for diabetes, but when he was a trainee, I think he expressed his interest earlier on, and just went to some extra sort of teaching sessions, got himself became more knowledgeable about diabetes as a specialty, and then started seeing more diabetes patients in practice, and now is the diabetes lead for our practice.
Yeah, and I've also worked with a GP who, she had an interest in gynecology, and she hadn't done any formal extra training in that, she's just done extra reading really, but she had a role where local GPs would refer to her, and she'd be able to see cases that perhaps are a bit more difficult to manage but didn't need to be seen in a hospital. So she was able to, with her experience, help out other GPs in that way.
Thank you. And someone has just asked if you could possibly put your contact in the chat, just so they can easily access it.
Yes.
Next question, just asking if you're glad you went into GP.
Shall I answer first?
Yeah.
Sure. Yes, I think I've made the right decision for me. I think I was always, I think in medical school, I sort of enjoyed every specialty that I was exposed to, but I knew I didn't want to do surgery. So it was either hospital medicine for me or general practice. So I liked everything. And I think as going through the sort of pros and cons, the pros really did it for me in terms of sort of flexibility in working hours and the sort of broad range of you could do after you qualify as a GP. And the training is quite short as well compared to other specialties. So it's only 3 years at the moment compared to other hospital specialties. So that's what really drew it for me. And I'm enjoying it so far. So it's so far so good.
Yeah, I think I'd reiterate, I'm glad I chose it as well, for similar reasons in terms of the flexibility and the other interests that you can pursue. And also, to be honest, I got a bit fed up of doing lots of night shifts in hospital, so I do quite like the daytime working in the week.
Thank you. I think someone might just be a bit confused about just the training path and earning. So they've asked, would you only start earning after the 10 to 12 years of training unless you get a part-time job while training?
No, so once you finish medical school, then you start being paid. So although it's called training, so we've referred to foundation training and GP training, you are paid for those roles. So you're employed, but you're just being trained at the same time as well. So you're still working, but training on the job too. So you get paid as soon as you finish medical school and start foundation training.
Thank you. Next question was asking if it's more difficult to get job offers for GP, I guess, if you're applying to like special interest, because obviously you'll be spending some time in the hospital, sometimes in GP. Do they take that into consideration, or?
I think so. General practice. So there's quite a big need for general practitioners at the moment. So depending on which location you've opted for, generally even in London, which is one of the more sort of popular places, you will get the job offer as long as you have the qualifications and you do okay in the interview. And if you have a specialist interest in something, I think that's actually sort of a bonus. I think it would be you'd be more likely to get employed because people like people who have additional skills. So if you have extra qualifications in sort of special interest in paediatrics or a diploma in obs and gynae, I think it would probably boost your employability. What do you think, Katie?
Yeah, so
your
just
experience?
I totally agree with that. And just to add to that, you don't need to have a special interest. So I think you'll still easily get a job without one, but people might actually look for people with a special interest in something maybe their practice needs more help on. The other thing to mention is there is a GP shortage at the moment, so it's quite easy to get jobs and quite easy to say what days you want to work and things like that.
Next question. I guess as GPs, you obviously deal with quite a bit of like ethical dilemma. Someone just asked us sort of any tips to kind of deal with those ethical dilemmas.
It's a tricky question.
Yeah, were there any specific ethical dilemmas that you were talking
George,
about?
if you've got any specific ones that you wanted them to talk about?
I guess as a trainee, if I was in any difficult situation, I'd probably escalate to a supervisor or a senior. And even as a qualified GP, if I was faced with an ethical dilemma, there's always, you can bring it up in the practice meetings, you can discuss it with colleagues. And if it is and if no one can answer your question, then if it's a big ethical dilemma, I'd probably speak to indemnity professionals at the MGU or MPS.
Yeah, so I'd agree with that. So I think just asking for help from others if it's something difficult to manage, and legal advice if you require.
And then people just asked about sort of the impact of an F3. So would that mean that you sort of have to have a stronger portfolio to get in the next year? Or is that something that people like to see or something they don't like in GP?
I'm happy to take that. So at the moment, I think the stats are around probably just over 50% of people take time out after foundation year 2. And in terms of applications to specialties, I don't think it makes a huge deal of difference. So that you won't be penalised for not doing it at all. Sometimes you might do something within that year that helps with some specialty applications. So I did do the extra medical education qualification. In terms of GP applications, that didn't make any difference whatsoever having that. But for some specialties, they do look for experience in, for example, one of the things they look at is teaching, or have you done any additional qualifications? So it might help you for some specialties, but not all, and they all have slightly different ways of looking at it. If you're somebody who doesn't have sort of a British passport or right to work in the UK, sometimes it can be difficult if you take that time out in terms of applying afterwards. So some specialties, if you haven't gone straight through, they might penalise you in terms of that if you're from abroad. However, a lot of specialties are now changing that policy, so hopefully even if you did take time out in the future, you'd still have fair access to the jobs in that case.
Yeah, I would definitely recommend an F3 year. I personally took one as well after foundation year training. It just depends if you what you plan to do in it. So I personally went to Australia and got some experience in A&E, which I guess wasn't really. I mean, it made me more knowledgeable about A&E as a specialty and the presentations that were involved. But as for my application, I don't think it made any difference, because they don't look at for the GP applications. I don't think they looked at my CV or anything. They didn't ask me about what I did in my F3 year, so it makes no difference. If you want to do an F3 year or a locum year, then I'd say go for it. And
Rachel's also just asked if there's a place where you could find the different GP programs in the different regions, if it's available online.
Yeah, so they're usually on the Higher Education England website. Each region will have a different website, so it's a bit of Googling really. So I know, for example, there'll be Higher Education England Yorkshire, and that will give you more information. Sometimes individual, even smaller areas than that, or individual programs might have their own websites as well. So I know my program, which is just one hospital, has its own GP website. So it's quite a big job to look through them all, but maybe if you start with what region first, and then you can look into once you've decided on a region that you prefer, then you could look in a bit more detail if that's helpful.
So what aspects of your job would you say you find the most interesting? What would you say you find the most difficult?
So for the most interesting, I think, as we mentioned before in the talk, anything could come in through the door. So I think it's such you need to have a broad, very broad, but basic knowledge of a lot of conditions. And I quite like the uncertainty of what's coming, not knowing what's coming in through the door. And I like the fact that, sometimes the answer isn't clear and it's sort of and it's nice to also be able to follow up your patients. That's what I enjoy about primary care, the longitudinal aspect of care. So following up patients from birth to the end of life. And for the most difficult, I probably say the same. So not knowing what could come in through the door. It's interesting, but it's also very difficult, especially as a trainee. And I'm always forever sort of asking him questions about, I have no idea what's going on. But it's a steep learning curve when you start, but you will get better at it with practice.
Yeah, I'll answer that as well. So I think in terms of the cons for me as well, patients can come in with anything, and you might not know all that much about some of the more rare things, and so that can be difficult, but there's lots of support. So as a trainee, from your supervisor, but most GPs in practice support each other, so you can always ask your colleagues if you're not sure, or ask your colleagues in secondary care as well. In terms of the pros, for me, similar to Kai, I think it's just the variety and all the different patients that you see. So as I said, I really like pediatrics. So I love seeing kids in GP, but I also really like elderly medicine and palliative care as well. And so you get to see those patients too. And that's one of the main reasons why I chose GP.
There's just some question just about the training path and getting into it. Someone's asked if it's true that if you obtain over a certain score in the MSRA, you don't have to do an interview. And just a bit more about the interview, what the interview's like.
So they're not actually doing interviews anymore in the application round for 2021. So it used to be that if you got over a certain score in the MSRA, I can't remember exactly what the cutoff was, if you got above a certain score, then you'd automatically get a job offer. But this year, everyone is being nationally ranked on the basis of your MSRA score. So I think, they don't use anymore. It used to be that you get called into a selection centre and you'd go through the interview rounds again. But this year it's just on the basis of your examination score.
So I did the interview when I applied. So I don't know if they'll bring it back in exactly the same way, because I think if it is brought back, a lot of the colleges are taking this opportunity now to change things and things that they didn't quite like. So it might come back differently. But how it worked before is that you did it's sort of like a situational judgment test question in a way, but you had sort of 5 different tasks that you had to do, pretending that you're sort of a doctor in foundation years, and you had to prioritize those tasks. So one of the tasks might have been you need to speak to a patient's relative that's really angry about their care, or another task might be a patient that's deteriorating and becoming quite unwell, for example. And so you have to put those tasks in the order in which you think you should do them, and then justify why you put them in that order and reflect upon that. So that was one of the tasks they had before. And then the second task was consultations. So that was, you might be talking to a patient about something, you might be talking to another healthcare worker about something. And that was one where you'd have an examiner in the room and you'd role play those consultation skills. It's not based on having lots of clinical knowledge. It's mainly about how you interact with people and your communication skills.
So next question is just sort of asking about an MDT and the GP, sort of how that works and what the needs of the GP are.
Yeah, so there's definitely lots of MDT work in general practice. So as